really going to be a great show for me. I'm very excited to have Dr. Miguel Rivera, who I've met recently, but I feel like I've known for a long time. We really seem to have a lot of similar ideas about health, and he is a psychiatrist treating lots of geriatric population here in town, but has a holistic bent to him that I really hope to explore tonight, and hopefully will be helpful to you and your family. So, Dr. Rivera, welcome to the show.
Thank you, Mike.
Thank you. Can you give us just a brief background about your medical background and a little bit about your practice here in town?
Sure. I did my School of Medicine in Columbia, Missouri, at the University of Missouri, and did my psychiatry training at the University of South Florida in Tampa. And then I've been down here in Sarasota for about 7 years, and 100% of my practice consists in going to assisted living facilities and long-term care facilities and treating residents there.
I know that has got to be a very busy job because there's a huge need for that. I know they always really appreciate the doctors that can come see patients there, and there's such a need for people to help deal with a lot of the different diagnoses that are going on, and frankly, I guess for many doctors they probably would all run together. Can you maybe give us a feel for the range of different types of problems that you treat?
Sure. I think in general I see three main populations. The first one is the rehab population, folks that have had a stroke or a motor vehicle accident, and they are in the facility for a brief period of time, kind of going through those changes, going through the losses of independence or whatever, because all of a sudden now they have to deal with a post-stroke brain. I also see residents that are in the dementia unit. And these are, of course, kind of more at the end of the spectrum where, they may have been wandering and the families are unable to care for them. And then the last population is more the long-term care folks that are perhaps more cognitively intact, but due to their medical problems are in a facility.
I was fortunate to spend a little bit of time with you the other day and hearing a little bit about some of your ideas and some of the issues that our seniors are facing here in town. Certainly as a psychiatrist, most people would expect that medicating people is a huge part of what you do. Can you speak to how the medical community typically deals with dementia problems and people that are maybe having hallucinations or problems in facilities? How are they typically dealt with, and how do you see that as a long-term solution?
Well, I think that the reason why we are here tonight has so much to do with that. Where I trained at the University of South Florida and what the standard of care in the community is as far as dealing with people with agitation and dementia has to do with medications, either benzodiazepines of some sort like Ativan, Xanax, or the use of antipsychotics. Now, approximately a year ago, some studies started coming out that were referring to the fact that these antipsychotic medications were not as safe as we thought they were. And that indeed, even though it's a small risk, but there is definitely an increased risk of having a heart attack, having a stroke, developing swallowing difficulties leading to developing pneumonia. I guess the straw that broke the camel's back was a continuing medical education journal that I received that said that if you start an elderly demented person on an antipsychotic to control their agitation, they are 3 to 4 times more likely to end up either dead or in the hospital within the first 30 days of initiating therapy. So when I read that, I didn't know what to do. I'm going, well, how can I truthfully continue to prescribe these medications and not, and just kind of turn my back to this, even though they continue to be the standard of care. So that propelled a renewed interest in researching things. And through months and months of research, then I started reading about the influence of diet on dementia. You know, how sugar is so implicated now in the what we call the pathogenesis, or in the you know, causative factors of Alzheimer's. Started reading about aromatherapy and massage, and the use of other therapies like music, for example. Luckily, just as you know, these things are beginning to really take form in my head, I pick up a facility that is interested in really trying some of these things out. So I think that in general, people in the community and these facilities are really beginning to see that medicating is certainly an option, but it should not be the only option.
It seems like the issues with medications are certainly not just in your field. They're in cardiology and every single field out there, and it just seems to me that, you know, you read one drug after another is being finally taken off the market after so much damage and harm has been done. And it just seems like, you know, the medical industry seems at a loss to be able to deal with the problems that we have, and it seems like they're constantly dealing with symptoms as opposed to treating causes. And there seems to be the, you know, the difference supposedly between what a quote-unquote holistic doctor would talk about versus, you know, a traditionally Western trained doctor.
Absolutely.
Do you think the difference comes from Eastern thought versus Western thought, or is that where it started?
Well, you know, I think in many ways it started back with Hippocrates, you know, who is considered to be the father of medicine. And this guy said, "Let thy food be thy medicine, and let thy medicine be thy food." And I think that, you know, when you take a drug, you take a pill, you put it in your mouth and you swallow it. And it's the same route of delivery as food. You know, you take the food and you put it in your mouth and you swallow it. And you expect the medicine to take an effect, but somehow we are not particularly concerned about what is it that the food that we put in our body really does to us. And that was one of the very first things that I started to really look at with interest, was when more and more papers are coming out indicating that Alzheimer's disease is a insulin resistance disease at the level of the brain. One of the studies...
What does that mean?
That's diabetes of the brain.
I see.
They call it diabetes type 3. So, you know, a holistic practitioner, the first thing that they would probably say is, how is your diet? Yeah. You know, what do you eat? How's the stress level in your life? And
we have to go to break right now. When we come back, I really want to get into this diet issue because it's, I think, the crux of the whole matter.
You bet.
Stay with us.